Hello, everyone, and welcome to the CoROM podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric O'Kelly. This week, we are with Bobby Litton, who is a graduate of our Paramedic program and has been teaching for us here at the college. Bobby, welcome to the program.
Hello, thanks for having me.
Tell us about yourself and what's keeping you busy.
As you mentioned, graduate in 2016, so a few years ago now. Had a very varied career as a paramedic. Worked initially, obviously, in the COVID protection circuit, and then now currently in the UK. Did a bit of time on the ambulances, and currently working my way through 2 master's degrees, one in pre-hospital medicine and the other one in advanced clinical practice.
Does that mean you've got your ACP registration?
Not yet. So I'm currently doing the masters, and I'm hoping to get next year one of the RChem training posts, which is what I'd like to do.
Are you thinking about upgrading to med school? Because isn't there an option for you as a ACP to skip into advanced standing in, was it Chester medical program?
And I've not had a look at it yet. It's definitely something that's sort of on the peripheries. I think with the two masters and juggling life and trying to balance things out, it's just trying to keep myself sort of focused on one thing at a time.
Yeah, and it requires you to be an ACP for a few years anyway, so you have time.
Yeah. So I mean, it's not a no, and it's not a yes at the moment, and it's definitely something that will be considered when the time comes around.
So you graduated 2016, which I think that was the very first program that was CoROM. How was that course? What did you learn, or what could have been improved at that point?
It was a really good course. So go on and finish. We'll finish on positive. We'll stop with the negative. The biggest, I think, hardest thing, and it still stays the same now, because I do part-time distance learning with my masters in medicine, is the language. Trying to, you'll learn a word that you can't pronounce that's in Latin, and you sit in a classroom and somebody will be saying that word but pronounce it completely different to how you've taught yourself, and you have no idea what they're talking about until you try and say that word and they like correct you. So that's probably one of the hardest parts of studying medicine, is getting to learn the language. And then enjoyment wise, I was quite lucky. We had a very, very good cohort and I was there. I'm still friends with a few people from and stay in contact with them. It was run at a good pace. It's not easy. You have to put a lot of work and a lot of effort into it. But it's run at a good pace. And, by the end of it, I was pretty confident for my placements, which I spent in Johannesburg.
Oh, you did all your time in Johannesburg on the ER24 ambulances, or was it at Tambo Memorial Hospital, TMH?
Yeah, so I did wait for my time in the TMH, which is very, very eye-opening. I did a lot more than what I've been allowed to do in the UK. And as a willing student, they were very accommodating and, very sort of helpful to let me get hands-on and get involved in pretty much anything and everything that I was willing to have a go at. And it obviously was safe for the patients.
So Dr. Samir there is still there, in fact, and he's doing a profound job in pushing evidence-based medicine forward.
Yeah, it's a phenomenal place, and it holds a very special place in my heart, without a doubt.
Have you been back down since?
I haven't, and I keep saying I'm going to go every year, and then I take on another project, and then it's just, yeah.
Maybe it's something about doing 2 master's degrees at the same time.
I know. I'm not sure that was such a wise idea.
So you graduated, you got your paramedic. What was your first job?
So I was working for demining protection, CV protection for a demining contract in Ramadi, which is in Iraq. And it was literally just behind the front line as they were pushing ISIS out at the time. So yeah, it was a pretty interesting place to be a medic. A lot of kinetic sort of injuries to deal with, and And then what you'd expect in a hot country, heat illnesses, people get sick with normal sort of illness as well. So yeah, it was very eye-opening and very sort of wide scope that I was working within.
So you're working out of a SUV or was it a clinic?
SUV, so mainly man-packed, and so more of a paramedic on the ground within the team. So my first role was obviously as a protection officer as part of the team, and then the secondary as the paramedic within the team. So my truck would obviously have all the medical equipment. So I'd have my own med Bergen, plus a larger Bergen in the truck. It wasn't very set out. We didn't have an ambulance due to the dynamic of what was going on in the area. It wasn't ideal. It was we were using Toyota pickup trucks actually, because you needed something that could deal with that terrain and carry everything around that we needed.
So do you remember your first casualty? You just finished the paramedic program. You're there in Iraq. What was your first job?
The cough. And yeah, and we all laugh, we do all our training and we're like, oh yeah, I'm ready, I can take on the world and I can do everything. And yeah, somebody come and knocked on my door after work one day and they'd had a cough for a few days. And I can't remember exactly how long. And yeah, it's a little bit, I suppose a bit of an anticlimax, but yeah, it's happily, I can't remember how I treated it, if they ended up with some antibiotics or not at the time. It was a few years ago now, but it wasn't as super interesting as I shouldn't say we should hope for, because actually we shouldn't hope for this on our patients. So just, we obviously train, so if it does go wrong, that we are capable to give them the best care. But yeah, when you train a lot, and I've spent pretty much my whole career putting a lot of effort into my training, I kind of feel like if something doesn't work out well for somebody, I'm kind of want to be the guy that turns up to help out because I know I can do a good job. So yeah.
When you went through the paramedic program, was the TTEMS included?
Yes. So the TTEMS was included. It was a very, very interesting course. It was something that really sort of sparked my knowledge. At the time, I wanted to progress more with, and then my career sort of taken a more of a, I suppose, a UK traditional route. Yeah, I would have definitely liked to have followed that up, and hopefully once I've got one of the masters fully finished, I've got a little bit more spare time to sort of carry on down the tropical med and austere sort of medicine.
What are your plans for that?
So there's the Trop Med diploma in the UK run by, I can't remember there's the school in London.
The London School of Hygiene and Tropical Medicine?
That's the one.
I'm there on Monday, yeah. So I highly suggest that.
And then obviously there's an advanced TTEMS at the college, which is on the list. So yeah, hopefully be able to jump onto that. It was very interesting. Jason, I'm sure he's been on a podcast more than once.
He has indeed.
He's a very interesting gentleman who's very, very knowledgeable. And he was the instructor on our TTEMS. And absolutely blew my mind as a human being how much knowledge one person can retain.
So I'm glad to hear that. Seeing that your first casualty was a cough, I think we might have covered some of that during the TTEMS.
Oh yes, we definitely covered plenty of normal illnesses and stuff that we probably see a lot more in tropical and austere medicine than people like to believe. People get sick wherever they are in the world, don't they? With normal illnesses. We
all like the bloody stuff. We all love trauma. We all practice trauma, and it's so few casualties that we see is trauma. It's all the primary care stuff that is our bread and butter.
Yeah, definitely. I mean, I've done my emergency care practitioner, my minor injuries, my illness course, and in the UK, and that was like a standalone. It's a double level 7 sort of masters. And I sort of split my time sort of 60-40 now, 60% in sort of urgent care, which is seen in the primary sort of care patients. And I'm still doing around 40% pre-hospital, because I kind of do this to be better as a pre-hospital clinician. I love the pre-hospital environment. I like the dynamic of it and the resource poor environment. I mean, even an ambulance compared to what you have in a primary care clinic or, an actual hospital, changes dynamic, and it's, the human factors and stuff like that. It just makes it really, really exciting. And, I'm a bit biased. It's probably one of the best careers in the world.
There is a lot of prolonged field care that is needed in hospitals, and part of that is because of the long queue waiting to offload your casualty at the A&E. Are you seeing that as well, where you're working pre-hospital?
So, that's definitely died down a lot now.
Oh, good.
But it's still something we see from time to time, unfortunately. And yeah, the hospitals in UK and the ambulance service have tried to jig. Well, I can't really think of a more professional word for it, but jig around and make it work the best they can, and try and get treatment on the go straight away. And it's all about obviously trying to do best by the patients, and the system that we have and we have to work within. We all sort of try and pull our own weight and provide the best healthcare we can.
So you're an ACPC registered paramedic, and one of the most common questions we get in the administration area of the college is, well, hey, is this paramedic going to give me ACP? Am I going to be able to register as a UK paramedic? And you are. Can you touch on how you managed to get ACPC registration?
So I've actually done another course in the UK, which is called it was by a company called Outreach Rescue.
Oh yeah, the banger program in Wales. Yeah, it's great.
Yeah, so that was good. To say I probably ate relatively easy compared to the rest of my cohort. I didn't study for one of my modules at all, and I came second or third in the overall grade in that single module. So yeah, I've managed to get registration. I've had to go through a separate course, and I think it's more to do with the time that I came back to the UK. As long as you can prove competency against what the HCPC require and you're meeting their standards, then there's no reason for them not to give it. But it is people have to remember it's an individual thing. So our two CVs can be very similar, but there could be something very minor that we can't. You don't want to pick out yourselves that the HCPC might pick up on, and that's why the registration. But they tend to be very helpful, and they'll give you a list of what requirements they will want from anybody registering as a international into HCPC.
We have, to my knowledge, about 15 to 16 of people who've gone through our programs to get the ACPC, and of our 150 some odd graduates. Doesn't mean that all of our graduates have tried, but it is difficult, isn't it?
Yeah, the course, although it's a paramedic course, it's completely aligned using those skills in a completely separate area. The UK paramedic is a ambulance paramedic. The course is designed for the ambulance service. Whereas obviously the CoROM course is designed, it's written on the tin, it's austere medicine, remote medicine, it's prolonged field care, the tropical med. These are all things that, we don't see in the UK. We're not, and yeah, we don't need the knowledge for, and therefore the guidelines and the education courses are shifted towards what's required. Whereas obviously, because I'm sort of repeating myself again, the CoROM course is shifted to the environment with training paramedics to work in a pre-hospital clinician that can provide the prolonged field care treatment in resource poor environments without a lot of help.
Yeah, speaking of pre-hospital time, once you finish your ACP, you're going to be forced to work in a clinic and hospital. Are you going to miss your pre-hospital time?
So I will feel, so in the UK we have what they call bank contracts with the ambulance service. I will take a bank contract with one of the ambulance services, and hopefully you have to do 2 to 3 shifts a month.
So you're going to be registered ACP as well as keep your paramedic registry.
Yeah.
And are you planning any outside of UK experience for you as a paramedic?
At the moment, not so much. I have been talking to a couple of companies in Africa to actually go out there and do some work. So I might put a hold on my education for a little bit to do some of the flight medic stuff out there. and often get approached by training companies to do teaching in UAE due to the experience and stuff that I've got, and from having a very, I suppose, non-conventional path to where I am at the moment.
I imagine your master's programs will help with that.
Yeah, they do me quite well, actually. They're holding in very good stead, I believe.
And do you have your IBSC flight paramedic already?
I don't know. It's something I might see if I can squeeze in over the summer break. And I have to have an extension of one of my essays, so hopefully I can get knuckled down on that in the next week. And if I can, I should have a bit of time over the summer, and I will do a bit of self-study and hopefully sit the American board, flight paramedic.
Are they looking for that on this job in Africa that you're looking for?
So they want to, a lot of them will, yeah, if you've got no experience with helicopters, that's kind of like a must. I managed to do a job in the UK as a retrieval medic on a helicopter for the
Nice.
oil rigs. That allowed me to get the experience. So I've managed to not necessarily get round it, but I've proved that I've got the competency to work on a helicopter. Not the same as the critical care helicopters we have in the UK. It's a very different sort of skill set, and again, very different to the search and rescue teams we have in the UK.
So for the HEMS jobs in the UK, what are they looking for? How can you stack your CV to get that job?
Oh, that's a very good question. So what I do, and that I've done so far is every time a job advert comes out, or I found some old ones, I've made a list of their essential criterias and their desirable criterias. And I've put out of that, I've got quite a long list of courses that they would like. And that, goes everywhere from something like the PHGLS course, you have the Resus Council ALS. Some of the criteria will probably have done listening the American ACLS or European ALS. And then they can go up to, as much as the diploma of immediate medical care, which is run by the Royal College of Surgeons in Edinburgh. I had a go at that when I was very newly qualified. I came up a little bit short, unfortunately. It's a very, very tough exam. It's designed for the doctors that have gone through the training program, and they tend to sit that 6 months to a year after having essentially a full part-time role within the HEMS service.
Yeah, it's a bit mental, isn't it? I've heard it's very difficult.
Yeah, I suppose as a paramedic, the exams and the way that they did them, so it's a single best answer written exam, and that it threw me a little bit throughout the exam because I've never sat one before, and so exam technique definitely played a little bit into that. And then I can't remember how many stations it was now, but you essentially have like lots of different OSCE stations, and you move around one to the next, and you get a short period of time, around 8 minutes, and there's a simulation for you to run through, and then you're scored, according to the criteria that's laid out by the guidelines that the station's aligned to. So it might be a pediatric trauma, and it will cover everything from, you're expected to see in the UK for pre-hospital care. So, we're talking, I mentioned the trauma, but as well as something like mental health, non-accidental injuries, it's a full range of skills that you would expect a expert or of pre-hospital medicine to know.
And did you do a prep course before you took the exam?
I didn't know. I brought a book and I read it, and I tried my best.
So, and that's pretty incredible, Bobby, that you almost passed, but you didn't do the review course, and you freshly graduated paramedic. I mean, if you have another go at it with the experience you have, don't you think you would pass it?
I'm hoping so. I mean, I did get a couple of, so one of the elements is I get to train with them on some simulations, because we don't, obviously, some of that, the skills that they're required to do, arterial lines and stuff like that, are outside of my scope in the UK. And so I managed to get some of that in. Well, I think, I'm hoping maybe January, if I can knuckle down and get my head in the books. And the big thing is getting not having the environment to put those skills into practice. So you get the book knowledge, and this is something you used to with data. So you get book knowledge, you got hand knowledge, and it's being able to get that knowledge out in an OSCE sometimes. And when you're not in the environment where you can, I suppose, simulate how to practice that, it not a massive disadvantage, but it just doesn't allow you to, I feel like, perform to the best of my ability.
It's a difficult exam, even for the people who are doing the job all day, every day, as you said, 6 months ahead of time.
Yeah.
And it's something that'll help you get your HEMS job, though, wouldn't it?
I'm hoping so. I mean, that would be, definitely something I'd like to do in the UK for us pre-hospital clinicians. HEMS, or even a basic charity, is kind of like the top of the sphere. There isn't really any higher sort of clinician, and I'm very competitive. I've always been quite competitive. So if I do something, I kind of want to do the best I can, and that sort of drives me to constantly do too much and take on as much as I possibly can.
Have you looked at the ATAC as well? Where would the ATAC help you get the job?
So I've done ATAC, and I'm currently going through their instructor candidate training
Oh, well done.
process.
Nice.
Hopefully up again, I think September. So yeah, ATAC was a really, really good course. I did that 2 years ago, and it's really, really good. It's an experience and a half. It's exhausting. It was 3 days, and I can't remember how many scenarios. It was 20 something, I believe. And yeah, I mean, I slept for a couple of days afterwards. How was it?
Yeah, it's a tough one. The train wreck one was a tough one, to walk in the wrecked train and try to pull casualties out. It was definitely a challenge.
It was, yeah, I mean, definitely. Yeah, it was quite interesting. A few people got a bit lost with their equilibrium in there, definitely, because it was a bit of an angle. And it's definitely a recommended course for anyone that's looking to really get exposed to trauma and get good at it in the UK. The manual, I believe, is available free online, so it's definitely a good resource.
So it sounds like you're doing all the right things to get the HIMSS job. You're looking at the DIP IMC. You got your ALS, your PHTLS. You're getting your ACP. It sounds like you're right on the path.
Yeah. So at the moment, they don't really require the ACP, but I think with the way I'm trying to be a little bit smart and think about the future. And I believe that the ACP route will potentially be where they go. When you look at the Welsh EMERTs and the Swiss retrieval team, they do an ACCP, but essentially because they do a lot more retrieval work in their services than England, and so I believe that'll be the way that we'll sort of eventually go with all of the HEMS. So having the masters already sort of takes away the stress to kind of do that, and also I suppose it gives you that tick in the box. You've already got the master's degree. You can study at that level, so it's just going through your portfolio of sign-offs and skills and prove competency.
But doesn't the UK already have a master's level pre-hospital? What was the ECP? Was it?
Yeah, so emergency care practitioner. So the emergency care practitioner course that I've done so far, that's just minor injuries, minor illness. It's sort of aimed more for your urgent care side of things. It's not massively aimed at pre-hospital medicine. There are masters. So the master's degree that I'm doing at the moment is actually called pre-hospital medicine. It has that Queen Mary's in London. Run
Nice.
by the Institute of Pre-Hospital Care, which is the training wing of London Air Ambulance, and the sort of head paramedic, or paramedic, he's not paramedic, he's a doctor. I'm probably falling off. I said that. He's quite well known, Mr. Gareth Breer. He's written a lot of papers. A very interesting fellow to have a conversation with about medicine in the pre-hospital environment. And it's covered. It's massively changed my practice and the way I approach the job as a person. So it's definitely done what it's supposed to do, I believe.
So your dream job is getting on retrieval or HEMS, and you're already into the teaching role. So you have a choice ahead of you, don't you? You can do an educational doctorate or a doctorate that'll help you teach, or you get your MBBS. Is there another one that I missed, or that's the directions you're going?
Yeah, I mean, I'm just sort of putting myself in the position to, I suppose I can pretty much go do what I want. And, let's say the world is my oyster. It's a lot of hard work and stress and arguments in the house. But, you know, it's, putting myself in a position where I've got options for whatever I want to do rather than sort of tunnel myself into one direction. Does that make sense?
Yeah, indeed. It'll be interesting to see where you wind up and see where your passions lead you.
Yeah. So, I think for me, it's probably going to be about another, there'll be a 10-year journey for that. So the next 10 years will be sort of it'll another year or two of doing my main education of what I've already committed to. And then hopefully that's when the doors will start opening up and we'll see where I sort of end up. I mean, ideally, I would like to do the Royal College of Emergency Medicine portfolio for the ACPs, have a job share with a HEM service, which is getting a bit more common for paramedics now and the nurses. We now use personal nurses, which is good. So that's, definitely a possibility for the future. And that would, I think, give me what I want. I get the pre-hospital exposure. I also get to do the medicine that I enjoy as well. I really enjoy medicine now. I was all trauma when I first started. And the more education I've done, the more medicine I've got involved in and enjoy and want to learn more and be able to provide better care that way.
Well, you bring a lot of experience to your teaching, and you've been down to Malta a couple times. What is your goal in regards to teaching for the college?
Um, so for me, it's just about producing. I always say to somebody when you start, it's about being a good new guy. You know, it takes a long, long time to be a good medic. I've been doing it since 2016, and I would probably say I'm, and maybe it's because the peers I choose, I would class myself as a pretty average medic. Um, and so it's just about providing the guys a good base level to go and be safe and to provide that care. As a good new guy who's got a passion to know that if you keep pushing in this industry, you can learn so much and provide such good care. And, hopefully that is what's going to lead me to the jobs that I want in the future, having the sort of the right attitude. Yeah, there you go. That's what I'm after. I like to impart the right attitude onto students. And I think that's going to make, them or their careers work well for them.
That's not something you learn in a book, is it?
No, definitely not. That's definitely being an ex-infantry soldier, a tiny bit of arrogance getting in my way and learning the hard way a couple of times.
Yeah, as a fellow knuckle dragger, it has been a challenge to up my game. And as you said, surrounding yourself with the people that's going to make you better. I have a saying that if I'm the smartest one in the room, I'm in the wrong room. And you have to surround yourself with people that challenge you, that make you want to be better.
Oh yeah, definitely. I definitely try and stick to that. I try and most of my peers are further along their journey than I am. They impart knowledge to me, which is good. Sometimes I can give a little bit back, which is also quite nice and a bit reassuring that you're doing the right thing. But yeah, I always, surround yourself by those people that are smarter than you, and hit the right attitudes and going in the right directions, and eventually, I think there's a phrase about you show me your five closest friends, and I can show you your future. And I believe that's sort of the same phrase or same meaning as if you put yourself in that environment, you're going to be that kind of person, aren't you?
Indeed. Bobby Litton, my final question for you is this. What advice do you have for the new paramedic, the new nurse, or the new doc interested in working in austere environments?
On CoROM. Obviously, you're going to need to get some experience. And the goal is getting that experience. Sometimes you have to do a bit of volunteering work. You're not always going to be lucky enough to get a paid job. but small little expeditions and stuff. Obviously, you didn't do anything high altitude. Don't be a medic the first time you're doing it. Make sure you've walked up a mountain before, because there's nothing worse than a medic going down with altitude illnesses. And then put yourself out there, volunteer for stuff. Don't but make sure you have a look and be smart about it. Don't volunteer for stuff that's really, really complex. It's going to put you outside of your comfort zone. You need to have some sort of interest in what's going on. If it's walking up the mountains, Kilimanjaro, for instance, if you're going to be a guide or a medic for a walk on there, I think the BBC have had it done a few times for charity. If I remember right, they've had some celebrities go up and, they've talked about how some of those have got altitude sickness, but, getting involved in, and having an interest in what you're going to go and do is going to get you a foot in the door. And then the more you do that, the more experience you can do. You get yourself in education, but I joined the infantry at school because that's all I wanted to do. Was no interest in education. It's bit me in the bottom since. And I struggle with education writing and, a bit of stubbornness to stop me through that. But educate yourself, put the time into the courses, find your weak spots, reevaluate that all the time. And if you keep pushing to be, I say to all the students on the last course, keep pushing to be a better medic.
Well, Bobby, thanks for joining our faculty. Thank you for being a guest on our podcast.
No worries. It was my pleasure. And hope everybody enjoyed listening to my voice for a little bit.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at corom.edu.mt.